Hello and welcome to the Foot Health Show here on UK Health Radio, your global, real, feel-good radio station. My name is Peter Allton of Circle Podiatry.
And my name is Jonathan Brocklehurst. It's our aim to raise your awareness of just how important your feet are, to give you the solutions to your foot and leg problems, and to teach you how to prevent future issues.
So grab a cuppa, relax, sit back and put your feet up and enjoy learning about the one part of your body that often gets forgotten. That's right, it's your feet.
Thank you for listening to the Foot Health Show on UK Health Radio. My name is Jonathan Brocklehurst, and today we will be exploring a topic that shows us just how important our feet are. This show is all about the significance of our foot health in our everyday lives, the decisions we make, and the information we read and listen to relating to our foot health can be a beacon to others. And that is why the Foot Health Show exists, to inform you of inspiring and innovative ways to address our feet and mobility in the current world.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
We are grateful for the support the show receives from across the world. And if you're interested and feel this show matches your vision for shedding light on the importance of our foot health in enhancing our lives and preventing limb loss across the globe, please refer to the UK Health Radio website with details on sponsorship and donations.
Dr. Adrienne Sharples is a HCPC registered podiatrist graduating in 1988. She worked in clinical practice for the National Health Service for 20 years, specialising in health education for the general public and foot care for high-risk patients, including those with diabetes. In 2008, she took up a non-clinical role as a practice education facilitator to support clinical staff and healthcare organisations in providing high-quality clinical placements to non-medical healthcare students, and have developed her career in education to become an academic within health and social care, and her current research interests include examining the influence of feelings of belonging and motivation to care on retention and career choices of nursing and midwifery students. Also, my second guest today is Dr. Joana Almeida, who is a sociologist with research interests in sociology of health, illness, and the professions. She is a senior lecturer in applied social studies, health and social care in the School of Applied Social Sciences, Faculty of Health and Social Sciences, University of Bedfordshire. She holds a PhD in health sociology from Royal Holloway, University of London, a Master's in Communication, Culture and Information Technologies from the University of Lisbon, and a BSc in Sociology from the University of Coimbra, Portugal. She was a postdoctoral research fellow from the Foundation for the Sociology of Health and Illness, UK, in 2013-14. Her main research interests lay on complementary and alternative therapies, health professionals, health regulation, and policy at chronic illness. She has published several book chapters and journal articles on these topics within the Portuguese and Brazilian context. More recently, she has expanded her research and teaching interests into the social determinants of health, prescribed drugs, and addictive behaviours.
So thank you for listening to the Foot Health Show on UK Health Radio. To listeners across the globe, today I'm joined by two very special guests from the University of Bedfordshire. So firstly, I'd like to introduce Dr. Adrienne Sharples a podiatrist, and also an academic who has a strong interest and expertise. Particularly today, he's going to be talking about diabetes and children's foot health, all under the umbrella of social determinants and socioeconomic factors in foot health. And secondly, I'd really like to introduce Joana Almeida as well, also an academic at the University of Bedfordshire too. And just a very, very warm welcome to you both. And just starting off our conversation really about social determinants in foot health. Adrienne, let's
Hello.
talk about, hi there. Just to kind of go in straight to diabetes, what is it about diabetes that's so important to grasp and grapple, particularly for our listeners today? Some of you may have heard of diabetes before, and foot health, the same conversation. But could you elaborate on that?
Yeah, sure. Diabetes is a condition where there are two types. There's type 1 diabetes and type 2 diabetes. In type 1 diabetes, the body's immune system attacks and destroys the cells that produce insulin. And insulin's a really important hormone. It helps glucose move from our blood sugar into the cells and get used up. In type 2 diabetes, often this can develop in middle age, but increasingly we are seeing people who are younger developing type 2 diabetes. There are two different issues really with type 2 diabetes. One is that your pancreas doesn't produce enough insulin, and secondly, that the cells respond poorly to insulin and the uptake of sugar from blood glucose. Thinking about social determinants, we do know that type 2 diabetes particularly is on the increase, and that there are ties to people who are from lower socioeconomic classes. So people that are from lower socioeconomic backgrounds are more likely to develop type 2 diabetes than people that have more prosperous backgrounds. And there are a number of issues for that. One reason could be that people that are from more modest backgrounds are more likely to give birth to low birth weight babies, and we know that's a factor in developing type 2 diabetes. The other thing is that people from lower socioeconomic backgrounds are more likely to have high body weight in middle age due to poor nutrition, and those factors sort of mean that people are more at risk of developing type 2 diabetes. We also know that men are more prone to developing type 2 diabetes, and that the impact of diabetes can be more pronounced with problems with the foot later on. So people from lower socioeconomic backgrounds are more at risk of developing problems with eyesight, feeling in the feet, diabetic ulcers, for example.
Well, thank you for really shining light on that, Adrienne, because I think, like you say, from my experience, I saw quite a few patients with neuropathy and also patients who see clinic and then go to their retinopathy scan in my clinic. It really does shine light on the fact that diabetes and in socio-economically deprived areas, I think really it really shows that actually access to quality care, to preventative care, is really important. Actually, I wanted to bring in Joana here as well to this conversation, because I know that you were going to look at foot pain and policy in this, and I think that does have quite a strong link in many ways. Could you elaborate on that for me?
Yes, sure. Well, yes, prevention is a main public health way of looking at food health, such as, for example, some of the things that I would like to bring to the discussion are campaigns. I think even nowadays in a very technological society, social media campaigns or digital campaigns on professional and clinical guidance on basic food hygiene and appropriate footwear habits, as we will see it's one of the main problems and related to the social determinants of health as well. And also with what we, in sociology, and not only in sociology and social sciences in general, we link it very much with the social learning theory, right? That we basically our behaviors, we imitate them, and by observation, by observing the others, what the others do, right? And I think that this also applies to food health and food habits that the population have. So campaigns are one of the things that's one of the public health interventions that could be done, that it's very preventative, and also in terms of the health professionals provision of regular food health checks, exams, screening, and also promoting the places where these screenings can be done, that not only in the hospital or surgeries, but maybe in other premises and spaces, such as pharmacies, or within the community, other spaces, promoting, for example, social food care or community food care. But I will stop here.
No, I think it's a really, really important point, and actually to kind of bring together both points from Adrienne and yourself, Joana, is that by us being able to educate members of the public who may not have heard of diabetes, may not have English, for example, as their language, there's another aspect there, and being able to set up a program, a campaign, and a source of information effectively for different groups of people, both isolated, non-isolated, cities or in towns, and also those who may feel that, in terms of community support, I think you're saying about communities are so important. And actually, Adrienne, you were saying too about how diabetes as a condition means that it can affect children as well. And actually, if we're addressing all aspects of community around us, we can actually create a clear pathway for people to be able to address their blood glucose levels, and talk about HbA1cs and how actually keeping on top of those is so important for patients. And actually, I wanted to really address this further by saying that for a member sees, for example, a foot health professional for the first time, not a podiatrist, but a foot health professional who's in the support workforce, how could we best see a referral pathway, for example, which means that foot health professionals, then podiatrists, then GPs, then disciplinary foot clinics could actually be part of a really important interdependent chain from the preventative care right through to ulcer management, debridement, microbiological understanding of the bacterial infection of an osteomyelitic ulcer, that sort of thing. I just want to get your views on that in terms of social determinants and socioeconomic factors. What are some things, maybe campaigns, maybe ideas you have in terms of being able to address that sort of situation?
Thank you for that. I think one thing that I would strongly recommend being an academic is that foot health is something that we talk about, at undergraduate level, and understanding of podiatry and the importance of the diabetic foot and the professionals around good foot care, because I do think that we are a small profession as podiatrists, and we're not in every university. And I do think that an emphasis on foot health when people are training and when people are in work training to be a healthcare assistant is really helpful in help signposting people with foot problems and signposting the right to the right person. So I do think that more education of foot health and the multidisciplinary team would be really, really useful as well. I also think that referral into foot health clinics and multidisciplinary groups could be looked at as well. Sometimes referral is by GP only, and we know post-COVID pandemic that it's increasingly challenging for people to access medical services. So I do think that could be helpful, having a look at how to refer into foot health services.
Yes, I think it's very important, and too often the situation occurs where they refer to the GP. Of course, GPs, for the most part, are absolutely inundated with referrals left, right, and centre, and sometimes if the quality of the referral isn't there or not as succinct as the GP would like, it's just fallen by the wayside, just slipped into another pile. And actually, by improving that referral service, like you say, Adrienne, I think it's really important. Certainly something that, for example, they have the patient advisory liaison service, which in itself is quite good, but I don't think necessarily enough is done to ensure that advisory service is geared towards the educational part and to the complaints procedures that happen from patients. So maybe there could be a shift in the narrative as to how patients can access education. Actually, I wanted to bring forward
yeah. I was just, Jonathan, that your point is interesting. You made 2 points that are very interesting. The one is about educating, all related to educating the public, and one especially the public whose English is not their first language, which is a very good point. And the other point that I would just like to bring to what Adrienne and you were saying is because that's true that GPs, they have too many referrals, but that's the thing, right? So we would need to release them by probably increasing the number of support workers of food health support workers in the NHS, which I think it was proposed in 2021 according to the standards for the food health workforce, and the different types, and also making clear, because it seems that the field, the podiatry fields and health, or the food health field, it's very heterogeneous in terms of training and in terms of degrees as well in schools and titles. It actually looked very similar to, quite different, but with some similarities with complementary and alternative medicine or therapy practitioners. The amount, when I was looking for some information, I found this, and I found that was very simple, because my PhD was about complementary and alternative medicine practitioners, and there were many things that I found very similar. So I think that's probably standardizing these, and I think that's the way it is going, but it's not still there, right?
No, absolutely. And there's definitely so much more to be researched and looked into as the practitioner, how that melds into the current health system, and how does private practice collaborate with the NHS, if it does or if it doesn't. And I think there's always this schism between different factions of healthcare, in a sense, that this dichotomy between the remits of a foot health professional and a podiatrist, and does the GP feel intimidated that we're suggesting an antibiotic, and understanding flucloxacillin is not necessarily, according to research, the best antibiotic for bone penetration when it comes to osteomyelitis, and actually doctors are starting to, not necessarily, but starting to realise actually multidisciplinary does work, and it does make a difference when it comes to community healthcare, not just the acute setting, domiciliary as well, and fast sharing information, and also to kind of add to your point as well, Joanna, I think I agree with you. Certainly, when it comes to patient records and being able to understand very, very quickly, can we engage with this patient quickly? What history like? Systems like EMIS, for example, where we can access GP records as well very, very quickly. Just has really started to make a difference, I think. And so now looking forward to the future, I really wanted to bring this to the table to both of you, Adrienne and Joanna. What are your thoughts in terms of the future, in terms of social determinants? Yes, we've had COVID, but in terms of future challenges, what do you think are likely to create the biggest challenges for our public, but also for health professionals?
I'm doing a piece of research around sort of unrelated to foot health field, but looking at the impact of the financial increase in the cost of living and fuel and fuel use, which, while sounding unrelated, it has made me think about the impact of increasing prices on people's foot health, and the ability of people to purchase adequate footwear when shoes need to be mended or replaced, particularly for children. Because we know that children's feet really do grow very, very quickly, and that sometimes a child can start the new academic year with a new pair of shoes and need replacement by Christmas or New Year. So one of the things that I'm sort of concerned about is the impact of increasing prices and parents or guardians' ability to replace children's footwear at an adequate time when feet grow, because we absolutely know and have got evidence that if children are wearing poorly fitting footwear, then that has a knock-on effect on growing feet and the way that children walk. And if shoes are too small, that actually it can lead to foot deformity in later life, and also nail deformities that can cause everlasting issues. And we also know that if footwear's too big, for example, that children can experience blisters. So I think thinking around that there needs to be more emphasis on choosing good footwear, and obviously it's really important that where possible, children's feet are measured and shoes fitted by an expert shoe fitter. But where that's not possible, that perhaps guardians and parents know a little bit about fitting footwear, so that if they need to go to the supermarket or different chains where a foot shoe fitter is not available, that they have some education about fitting shoes to their children. So I think that's at the moment a really important message to get across to the general public.
I completely agree with that. And I think to our listeners today, certainly, wherever you're from right now, whether you're in Texas or whether you're in Australia, Melbourne, or whether you're in Europe, I think that we can all absolutely relate to that very point you've made, Adrienne, which is the way that we fit our footwear to our feet is very much going to influence the way that our response to that environment. And actually, to touch on that a little bit as well, is that listeners would have heard me mention this constantly over the last few months about deep and wide toe box, the secure and adjustable fastening, and that supportive heel counter, and all these ingredients to good footwear, which really do amalgamate the benefits of less of a dark, warm, moist environment, for this proliferation of fungal infections that can occur between the digital spaces. And I think that certainly, as you said, Adrienne, I think that bringing that message at the child level right from the beginning, I think, is so important for the way that, like I said, deformities can develop, and also further into in the aging process, which is that digital deformities, the hammer toes, the mallet toes, it's so reticent of that particular aspect of footwear choice over time. And sometimes, I'm sure you, in your experience, Adrienne, you notice patients say, "Oh, I just got my brand new slippers and they just slip on so well, I can get around the house and zipping around the house and great, and making my cups of tea." And actually, when we start to dig a bit deeper and we think about, actually, what is it about the footwear that might be causing potentially the pain, especially joint or medial or plantar aspect, and all these different things, the rubbing, the disasters, and everything else. And we start to think, was there fasting those slippers? Was there something that secured both ends? And actually, is there some mule slip, etc.? And actually, I think there's so to raise that awareness to not just, I suppose, the local communities as well, but much wider. So I really want to bring you in here, Joana, as well, because I know that you were saying about how with campaigns and with real impetus into the education of patients, and let's use the example you worked in Ealing and Southall, so very large Asian British population area.
Absolutely, yeah.
And actually, one of the things that I noticed was there was a real enthusiasm to get knowledge, but actually being able to reach communities that needed it most there was a challenge in terms of understanding language barrier, but also be able to communicate it in a way that could be clearly digestible, understood, and then put into practice. And I know we noticed actually by setting up a group with a translator, for example, that information could get out very quickly to larger numbers, say 20 as opposed to per patient. And so I wanted to get your views on that.
Yeah. No, absolutely. Thank you, Jonathan. No, absolutely. The translation is one thing that is already in use in other service areas within the NHS, right? When you have, especially for health professionals to deal with ethnic minority groups, they bring translators, and they see an improvement in the consultations and patients attending the consultations and attending more often as well. So definitely it's something that would improve in the field of foot health, would improve. But the other thing I would also like to bring to the discussion is the footwear industry, because personally, I have many difficulties in find half sizes. So my size, for example, is 6.5, and some brands and don't do sizes, so you just buy 6 or 7. and it's not your right size. So some of these problems, again, going back to the social determinants, and this one is a wider one related to the footwear industry, that could probably, some changes could start from there as well, by cater for the variation of feet in the population, and increasing their stocks of, doing probably a market study of population, the variation of the population's feet, and and improve the industry, the footwear industry. That's one thing. And the other thing, that because Adrienne talked about children, the other thing, because you also, Jonathan, were saying about the future, I also think that we have the older population to look after in terms of foot health, because life expectancy is increasing. It is increasing, although lately it has remained the same, more or less, if not decreased a bit for men, if I'm right, probably mainly due to the pandemic. But anyway, people are living longer and with chronic and with chronic illnesses. And therefore having more mobility issues, to go to healthcare services, for example, or mobility issues, just with that obviously will bring foot issues as well. So I think that the future is also should be also focused on the social group. And also in terms of, making sure, because it's a very vulnerable group in terms of loneliness, and your foot are so essential to combat loneliness, So it's something that I would like to say. I don't know if Adrienne would like to add anything else, or Jonathan.
I would just like to add, if older people have got poor foot health, they're less likely to want to get out and about, and with that, going out is around socialising with other people. And we do know that there are strong links between social vulnerability and frailty and morbidity as well. So if people are becoming socially isolated because of foot health problems, particularly in vulnerable groups and older groups, it's more than likely that they'll start down the frailty pathway as well. So I don't think we can underestimate how poor foot health, particularly in older people, can have a real impact on people's lives, and also the trajectory of their health going forward.
That's a really, really important point. Actually, a really good way to end the interview today. I'm so grateful to you both for your expertise, your time, and just so much stimulating conversation for all of our listeners today across the globe. Thank you so much to everyone. You've been listening to the Foot Health Show on UK Health Radio. Thank you so much to you both.
Thank you.
Thank you, Jonathan.
We are grateful for the support the show receives from across the world. And if you're interested and feel this show matches your vision for shedding light on the importance of our foot health in enhancing our lives and preventing limb loss across the globe, please refer to the UK Health Radio website with details on sponsorship and donations.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
Thank you for listening to the Foot Health Show on UK Health Radio. My name is Jonathan Brocklehurst, and today we have been exploring a topic that shows us just how important our feet are. This show is all about the significance of our foot health in our everyday lives, and the decisions that we make and the information we read and listen to relating to our foot health can be a beacon to others. That is why the Foot Health Show exists, to inform you of inspiring and innovative ways to address our feet and mobility in the current world. I look forward to you listening in and tuning in again next time.
Well, that's all we've got time for this week, folks. Thank you so much for joining me here on the Foot Health Show on UK Health Radio, your global, real, feel-good radio station. All that remains is for me to say, have a fantastic week. Keep safe, keep those legs and feet moving, and don't forget to tune in again with your friends next week.